My name's Neil Pease, Dr. Neil Pease. I'm an Executive Director in the NHS, currently working at University Hospitals of Derby and Burton. In terms of board development, we first started using Lumina about 2 years ago, something like that, when we started an organisational merger. So we really wanted to know, I suppose, how to get the most out of each other. We were quite a new board at the time. Now moving forward, we have just undertaken the merger on the 1st of July, so now we're now University Hospitals of. So we've almost got the past, what we did in the past, but now we're using Lumina currently to see what we can do as a new organisation moving forward. I think when you are on a board of a big organisation, we are now about 13,000 staff over 7 sites. We turn over about £850 million, and I think it can be quite high pressured. You're a very small group of people working together with a lot of responsibilities, and how do we get the most out of each other? I'm a particular fan of the overextended persona, so that's where I spend a lot of my time working. I think the NHS, as in any public sector in this country at the moment, is under a significant amount of pressure. I think it allows you to be a little bit more forgiving with people, with colleagues. I think understand that, you know, they are entering into that aspect of their persona in terms of being overextended. I think it helps you to look out for each other a little bit more. And I think from my own perspective, I think it allows you to develop alternative strategies that if you are under pressure, under stress, these are some of the behaviours that may come out. I'm currently on call for our hospitals this week, and I think that, you know, if it's midnight and you're taking some pretty big decisions about the hospital, the organisation, you know, are you going to divert patients from one emergency department to another, and you've got a lot of very worried people and you're getting pushed into that overextended persona? I think it helps you understand yourself, and I think you give better decisions. I think you're a better person for understanding that. At our trust, probably the same as a lot of NHS organisations, we have a group called Responsible Officers Forum. So we look at problems with doctors that may be clinical problems where things have gone wrong clinically, or what we're seeing more and more of. I would say probably 70% of the cases that we get referred to us as a group are behavioural related, either behavioural or 9 times out of 10 they're based in relationship difficulties. And sometimes you've got cultural differences. You know, with the NHS employs 1.2 million people. We employ people from all over the world. Sometimes there's cultural issues. Other times there is friction between different specialties who may not agree on a course of treatment. But basically, when you get a lot of very well educated people in one place under a lot of pressure, there is disagreements. And I use Lumina a lot to deal with doctors who are having difficulties in managing their relationships with colleagues. Strangely enough, we don't get very many who have in relationships with the patients. They can be, and you know, the abject professional when dealing with patients, but when they come into contact with each other, it is a different ball game, so to speak. So we use Lumina particularly to shine a light on those overextended personas, and particularly when things start to go wrong from a behavioural perspective. So I know that there are other NHS organisations who are using Lumina in recruitment, but we're just starting to use it for medical consultant appointment panels. Because basically, if you're coming for a consultant role, you have the piece of paper that says you are qualified to go for that. So they're all qualified to exactly the same level. So in terms of differentiating factors, there's not many to really go at. But what we've seen in the past with NHS consultant appointments is who you interview on the day, very nice person, fully qualified. Then they start work, and then sometimes we see problems start to arise, and frequently it is from when the pressure is increased, the level of work or the complexity of work increases, we start to see some problems appear. And we're starting to use Lumina as a tool to be used as part of that appointment process, and it's given a really valuable insight for the interview panel as areas of opportunity in terms of questioning, and some of the way how you would approach framing some of the questions to really try to push a little bit definitely again on the overextended personas, but also how that person would fit as part of a bigger team, because healthcare is a hugely team orientated profession, and you work with so many different people from so many different specialties, so it's really proving to be very advantageous with the appointment of senior clinicians.